Perfect. I think we just went live and we're recording this event. So welcome everybody. I'm very excited of being hosting this panel about career transition. We're gonna start by introducing this amazing panel. So I'm gonna start with me. My name is Miguel Villagra. I'm internal medicine by training. I'm a hospitalist. I also do telemedicine, and I have a business which offer coaching for career transition for physicians looking at new job in the market and gain the clarity to decide the best decision for their career. Today we're going to talk about the stories of some of the panelists and the experience they have among all different career changes that they have going through. But let me first get you to introduce themselves. We're gonna go in order as I see the screen, so we can start with Ryan.
Yeah, good afternoon, good morning to some, depending on where you are. My name is Ryan Cuff. I'm a OBGYN, then with further subspecialty in maternal-fetal medicine. I'm the division chief of the Division of Maternal-Fetal Medicine at St. Peter's in Albany, New York. And I think, as we'll get into, I made a career transition within the last 12, 13 months from academic medicine into community practice. So we're here in Albany, which is the town where I grew up, and I have 3 kids, and my wife, Nina, is a pediatrician in private practice.
Awesome. Welcome, Ryan. What about you, Sara?
Hi, friends. My name's Sara Schultz. I'm an infectious disease doctor, which is the best of the subspecialties. I'm in Philadelphia, Pennsylvania. I practice at Temple University Hospital in academic medicine. I'm an associate professor who's actually going up for professor. So hopefully soon I will get promoted. I am the vice section chief of infectious disease, and I'm the program director for the infectious disease fellowship program. I love infectious disease. We have a fantastic fellowship program at Temple. Temple's a great place if you're looking for a really high acuity, lots of transplant, lots of trauma. And my journey to infectious disease, I'll talk more about, but I'm very happy in my career path. And I hope that you all find something that makes you very happy. I live in South Philly with my husband and my 2 little boys. Thanks.
Great. What about you, Marianne? Welcome.
Okay, hi everyone. My name is Marianne Mugo. I'm originally from Kenya. Came here as an FMG, which is also known as foreign medical graduate, after practicing or training in University of Nairobi. I currently work in Georgia in a town called Taylorsville. I'm an endocrinologist. I've been doing this for almost 19 years. I really love what I do, as we all do, I know. I'll be happy to share a lot of my experiences. I've worked in different types of health systems. Currently, I work for a hospital-owned multi-specialty group, although in our clinic, it's only endocrinology. We do adult endo. I have 2 children, almost out of high school. And so my husband and I live about maybe 40 minutes away from downtown Atlanta. And so we've been here for the last 6 to 8 years. I don't do any academic, but we do have residents that rotate in our clinic as well as medical students. So I'm always happy to not only share the academic or clinical part, but to give them, life lessons or ideas on how to, go through their career process. It's nice to meet you all, and I'm happy to be here.
Fantastic. What about you, Khalid?
I'm Caleb Hentges. I am a general pediatrician in McMinnville, Oregon. I just started the job in mid-October. I finished residency at Oklahoma State University College of Osteopathic Medicine a little over a year ago, almost a year and a half now. And I practiced in Oklahoma with Cherokee Nation Health Services for a year as a general pediatrician there. And then now I work at a private practice. My wife, Jamie, is a nurse, and my daughter, Josette, just turned 2 about 4 days over a month ago. And her and I have the same birthday, and that's like my favorite thing ever.
Oh, wow. Thanks.
Fantastic. All right, so we're gonna get started. We have a few questions to for the panel to discuss. So we're gonna start with Ryan, and I want to see what do you think about what inspired you to choose your career path that you decided to go through. You say you went recently through a pivot as you were transitioning to a different role. Can you tell us more about your experience and insights why you decided to go that path?
Yeah, so I decided early in medicine I was interested in women's health and obstetrics in particular, and common or not, that interest kind of continued throughout medical school and led through residency in OBGYN. I really had a penchant for obstetrics and that I wanted I didn't dislike gynecology and I didn't dislike the surgical aspect of it, but I really liked obstetrics and I liked maternal fetal medicine from the standpoint of the application of research at the bedside and prenatal diagnosis with ultrasound and being with patients in what are many times exciting, but all too frequently, maternal fetal medicine is at the bedside at a low point in someone's life and breaking bad news. And I wanted to hone the skills, and I watched faculty who are expert at breaking bad news and having difficult conversations with patients and creating rapport in that type of setting. I always thought was a privilege. And so I followed that path and I went into maternal fetal medicine, and I did work. I was on the faculty educator track and in academic medicine for the better part of 5 years. And I realized that as much as I liked the academic part of what I was doing in terms of producing clinically and academically, working with residents and fellows, that really my interest lied with being at the bedside, being with patients, and just working day in and day out in that realm. And on top of that, so this gets into a little bit more of kind of our family story. We have 3 young children. We're from this area. I was in South Carolina from residency through fellowship and in faculty, my first faculty job. And as our kids got older, it got harder and harder to be away from our family. And so an opportunity came up in Albany that fit professionally, but also had some personal benefit to it. And we followed it. We kind of just followed that lead, and it brought us back home. It was transitioning from one job to another, as anybody who's done that on the call knows, is when you're a physician especially, is not an easy task. But it was something that was important to us. And so now I work in a clinical role, but I still work with residents, and there's fellows at the local academic center who rotate in our office. But it just better fits my interests. And the only way I knew that was going to be my interest was by doing something else and realizing that my passions were in a subset of what I was doing and finding a job that fit what I wanted to do 100% of the time.
Fantastic. A lot of time, one of the crucial steps before getting into a new position is to try to get that work of really set your priorities, what is important, what are your values, and go out there with a more intentional way to find a position that kind of mirror or check the boxes for whatever your priorities are. So we're gonna go to shift to Sara, and I'm gonna ask you the question: what do you wish you had known about the transitioning process during your residency to fellowship and fellowship to practice?
Thanks, Miguel. That's a great question. I'll be honest, I did not enjoy being a medical resident. I found it, and this was, almost 15 years ago, and I think the culture likely has improved nationwide, but I found it to be very toxic and very malignant, and I felt burnout before I really had a name for it. So I was nervous when I matched into fellowship because I didn't know if I would be able to withstand 2 more years of really brutal medical training. And then when I got to my fellowship, which was at Temple, it was like just a completely different experience. Like I suddenly had that moment that people talk about, that mythical moment where you're like, this is where I'm supposed to be. This is the type of doctor I'm supposed to be. And that felt really great because, I hadn't felt that validation from my medical residency. Some people love their medical residency and just click immediately. And some people don't. It's a difficult road to be a medical resident. So I guess one of the things I wish I knew was that it gets better I adored my fellowship, and I felt valued, and I felt like I was a partner, and the emphasis was really on education. And now I'm the program director for that same program. So those are the values and missions that I, lead, hopefully lead our fellows, our 8 fellows for. But then going from fellowship to practice, it's a quick 2-year fellowship in infectious disease. And there's a lot of responsibility as an attending. And I remember my first day as an attending, I got a page, and because it was all pagers then. And I remember saying like, oh, hang on, I have to go run this by my attending. And then I like looked up and I was like, oh God, like I'm the attending. There's no one to run it by. But that's actually not true. So I guess that you never really have to feel alone. There's always other doctors. There's always people to run things by. I think people expect that junior faculty will run everything by at least the internet. There's no shame in rounding with up to date and checking yourself, even on things that you've done a million times. I think there's obviously a lot of imposter syndrome, but there's also a lot of anxiety with any new promotion of role. So give yourself grace for sure.
Oh, absolutely. And we were discussing earlier on our Q8 about how frequent burnout is, and sometimes physicians don't pay attention to their well-being. And this is one of the missions I have on mind. I'm very passionate, as I've been burnout myself, that if you feel like you need support and help, go out there and find it, because there is resources that you can use to help you with your struggles. So I want to shift to Marianne. Can you tell us some challenges you face when transitioning either from your residency to fellowship or from your fellowship through your practice in endocrinology?
Okay, well, I would like to approach this from the point of view of an FMG, in case there are any FMG residents out there, because that actually has several challenges associated with it. And coming as a resident, the expectation is that you go through your residency and you go back to your country of origin, and you're on a visa. So you have to think about that. So when I was thinking about going for fellowship, not only did I have to match into a fellowship, but I also had to figure out that there has to be no gap between residency and fellowship, because you cannot have that, otherwise you'll be out of status. And the process, thankfully, in our residency, there was 90% foreign medical grads. So people had gone through the path. So, what I would like to advise residents is always ask someone who's taken the same journey that you have, and they'll be able to give you some tips. There were some things somebody advised me. They said, just get your case number. Even if you don't have a place, get a case number. And by good luck, I got my case number, and there was one position. They used to do Conrad State 30. There was one position pending, but you had to have your case number ready because the deadline was within a few weeks. And by good luck, I was the one who had it. So it's good to make sure you understand the process. So going from residency to fellowship, you need to account for how your immigration status will be if you do have to go through that process. Outside of that, just like Sara said, residency and fellowship are very different. When you're a fellow, you're kind of treated like an attending. They listen to your ideas, they trust your input, and you kind of feel, oh yeah, they're actually, they recognize my knowledge and my training, even though you're still a trainee. So transitioning from residency to fellowship, if you select or get selected to a program that's really personality, it will be very good for you. Once you're in fellowship, that's your network. Those are the people who are in your specialty, and they're the people you'll meet at all your annual meetings. When you go for your endo society, I meet all my fellow colleagues. Sometimes for the first few years, I would actually call them and say, okay, do you remember when we used to do this? Okay, can you tell me how we do this? So keep that network. And not only is that network good for your career, but you actually will have career ideas. Recently, one of my colleagues came to town, and we had lunch, and her career journey has been very different, but she gave me a lot of input about, how to think about the next few years, between now and because now we're in another stage of our training. And if you have somebody that you made good connections with in the beginning, you can go through all those stages of your career. So early career, mid career, late career, and use other people's ideas and experiences to plan ahead. So one of the things I would say if I knew better was start thinking about the next step, like plan for the next step, even in the current step. So if you're a resident and you're thinking of fellowship, great. But even once you're in fellowship, think about how you want to approach your job. When the first job I got, I had to get it because of my waiver. But I had two options. The one option I chose, or maybe it chose me because I didn't have a choice, but I'm so glad I went there because it was a very small community and I had young children at the time. And having young children in a small community, I can relate with Ryan. It's very helpful, especially, you need to get from one place to another within a few minutes. And maybe it's just the parents. You don't have family. We didn't have a lot of extended family. So keep in mind where you go for your first job. Then as you grow in your career, you'll find that you can allow yourself to maybe go to a big city and maybe you have more time to do your own activities. And so you need to make sure you have that balance. Make sure you balance not just the professional part, but also the other part of your life. And of course, your family has to be involved in the decision making. I hope
So
that
what I'm getting
helps.
from you is you want them to focus on the next step without forgetting about what is beneath them or ahead of them in the future,
Yes.
either 5 years,
Yes.
10 years, and so on. Fantastic.
Yes. Mm-hmm.
So, Kelly, could you share any tips for maintaining work-life balance or preventing burnout during residency or fellowship, or even those coming out of training?
Yeah, I think Sara mentioned it, and she said she didn't enjoy her medical residency. I don't know that there's a lot of people that actually really do, like, truly enjoy it until it's over, honestly. Like, you can look back on it fondly and be like, oh yeah, I remember that. That was fun. But it's hard no matter what you do. Like, I often tell people that I'm so happy I didn't do internal medicine or surgery because those seem absolutely terrible. And don't even get me started on OB. That seems like just surgery residency condensed down into 4 years. So even worse. But pediatrics was tough too. Like, it's long hours. It's hard work. It's constantly feeling like you have to prove yourself to everyone around you, the nurses you work with, the co-residents, the students that you're teaching, the attendings, the program directors, and it's a grind. It's hard, but I kind of do look back on it fondly. I mean, I'm not that long out of it, but I do look back on it fondly for certain things. Like, when you get out into practice, you don't have like a buddy with you at all times. Like, there's no co-resident or intern or med student with you at all times unless you're in an academic institution. And even then, like, they're not, if you're working nights, they're not there with you all night long. You're by yourself, and you kind of lose that sense of people going through the terribleness with you. Being attending isn't terrible. It's actually much better. But to avoid burnout, you really have to be able to identify it in yourself. And to mitigate it, you have to recognize it before it starts to take over and really bring you down. Something that I do that I started about midway through my intern year was running. I run every single day. I think today would be 1,806 days in a row. And I just go for a run. I don't do it for anyone other than myself. And just, not telling you to run every day, but pick something that makes you you, or something that you enjoy, or that's a release for you, and healthy release for you, and do that. Don't forget what makes you the person that you are. And if you do forget that, take a step back, because in training you have a lot of help and you have a lot of support, and that's so that you can make mistakes and you can learn and you can grow, and you can take time to figure out how you work best and how you deal with the struggles of life. Because, as all of you know, in medical school and residency, your life outside of it doesn't stop, and it feels like a lot of times you get sucked into this vacuum of only thing that matters is studying for my next test, or doing well on this board exam, or not getting yelled at by the attending again. And And it's really hard to forget that you have a family, you have friends who have no idea what you're going through. They watch Grey's Anatomy or Scrubs and they're like, oh yeah, I know what being a doctor is. And they try and relate to you that way. But honestly, one thing that works for me is when I get home from work, I don't talk about work. I made a goal when I was in residency that I would never do notes at home ever. For the other panelists, that probably wasn't an option when they were in residency. But for us now, you can do a lot of work from home in residency. And I told myself when I get home and be home with my wife, be home with my child, I'm not gonna bring the work home with me. And it kind of helped me separate. Like when I walk in that door, I'm dad and husband. I'm not doctor anymore.
Fantastic. So I just want to piggyback on a few things because Kelly have mentioned a lot of important things. And the first one is awareness. One of the things that sometimes we see ourselves as burnout as a sign of weakness, and it is not. Physicians, of course, unfortunately, due to the nature of our career, we are at high risk for burnout. That's a true reality, and we cannot ignore it. And it's better to act upon in the early stages, not when you wait too long. And the second thing that resonates from what he was saying is to set clear boundaries from work and your life. That's crucial. And I like to describe this as the non-negotiables. Like for me, my non-negotiable is have supper with my family. So that's a non-negotiable. Any job that won't allow me for it, I will just not gonna take it. As simple as that is. So we're just gonna continue discussing. I want to circle back to Ryan, who went through these pivot moments, and I want to ask you about the role of networking and mentorship, either during residency or shortly after. What have been your experience of building a network of support on your journey, on your career?
So networking and mentorship in terms of where I've gone in my career. So the things I've done outside of what I've already discussed. In 2017-18, I was ACOG's National Junior Fellow Advisory Council Chair. And so in that role, it was an elected position, but I was sat on ACOG's executive board for 2 years and was a voting member and traveled. So I traveled that year probably 60 or 80 days of travel, like that thankfully my program director at the time allowed me to do. I still took the same amount of calls everybody else, just condensed into a 300-day year and not a 365-day. So I have some challenges around, or some biases around travel, because I think travel led to a little bit of burnout in my life because I did a lot of it for 2 years professionally. But what I gained by doing things like that was a huge network of obstetricians, gynecologists in all walks of professional life from across the country. Like there's ACOG, I know they're a sponsor for this event, but with, my kids know like my ACOG work friends, like they grew up knowing these people. And so how that has benefited me by reaching out and going to meetings and meeting people and getting to know people outside of my locals. When I was thinking about a career transition, or I was coming up on a promotion, or I was looking to do something else in my career personally or professionally, I had a larger wealth of people that I could rely upon, whose ear I could bend. I mean, I can't tell you, how many times, whether it's, hey, can you call me? It's not urgent. It's a kind of a personal thing. Or, hey, I have this patient. I know this is something up your alley. I'm happy to discuss it hypothetically with you. Just give me some guidance. I think the one point I made a note to kind of deviate for a second, but what Sara had said about like rounding with up to date, you have everyone in your network, mentor, everyone in your network at your disposal, like just in your phone. And so I had this misimpression as a resident and as a fellow that the faculty were just so esteemed. They are, but they knew everything, like you were anointed when you graduated. And what I found out was when I left the resident and fellow text chain, there was a separate faculty text chain where they just asked each other questions all the time, but the residents and fellows weren't part of that text chain. And so literally it was the same thing we had in residency and fellow, but the faculty were leaning on one another. And so I think From a mentorship standpoint, I think you need to I don't know what everybody else's experience was, but just quickly, I think you need to let mentorship happen organically. I think some programs do some formal version of mentorship, which I think is fantastic. But I think really the mentors that have meant the most to me are the relationships that happen organically based on professional or personal interests and where they align. And I think you just need to feel comfortable approaching someone and saying, I like the research you're doing. Whatever the question is to open the door, I like what the research you're doing. Whatever just gets you a foot in the door to start talking to someone, and then you build from there. And that's really been the recipe for mentorship kind of in my career.
Fantastic. I definitely agree that or a circle of influence, as I call, right? People that can support you and align with the values or the career path you're choosing is crucial for your success. So we're gonna circle to Sara, which I think she's gonna like this question. So for my conversation with her before, so what tips or insights you have for residents that are between going for fellowship versus going to clinical practice?
That is a very salient question, because as a program director, I talk with residents a lot about, should I do fellowship? Should I do a hospitalist year? I feel like for a lot of residents, the draw of hospitalist medicine is very, very strong. There is a very, there's like a sexiness to being a hospitalist where it looks like you have lots of weeks off, and there's like a shift work kind of appeal to it. The money sounds good. The autonomy sounds good. If you're thinking about a fellowship, I really would have you speak to the PD at your institution, because I will say, not from personal experience, but from applicant experience, it is very difficult to go back and do a fellowship after you've already been practicing independently. I think financially, it's very difficult to go from making a nice 6-figure salary to making a less nice 5-figure salary. I think that the sort of like mental aspect of it as well, the more psychological aspect of it, of, well, I did what I want, my notes were the way I wanted them to be, I rounded when I wanted to now have to follow like a more strict schedule, can be a turnoff for some people. So I'm a big fan of like residency into fellowship if that fits the right mold. And I will say, a lot of people talk to me because they're in between infectious disease and something else. Onc is popular, and so is Pulm. So a lot of people will talk to me about sort of the pros and cons of each one. And, there's a quote I love, that infectious disease is one of the few great adventures left in the world. And I just think that's so true. If we think about what infections have changed even our lives, even before COVID, which is probably the greatest world history event that any of us will live through, hopefully. When you think about Zika, when you think about Ebola, when you think about SARS, HIV, Hep C, these are all things that really were in our lifetime and have completely changed the face of the earth. And they're ours, we get to own them. And in some cases we get to cure them, which is an unbelievable privilege. But I just think it's important to think about work-life balance, like we said. Think about your goals and your priorities. I like aligning, like what Miguel said, aligning yourself with your non-negotiables, I think is great. But excuse me, you also want to think about what you want your career to look like, because even though things can change, you really have to love your bread and butter, like whatever it is that you do. As an endocrinologist, like you have to love taking care of people living with diabetes, and Ryan has to love delivering babies, because there are just certain things that you're going to have to do a lot of. And for ID, I think you have to really love being detail-oriented, making lists, and getting your answers from the patient. I think ID, more than a lot of other specialties, really gets a lot of their history from the patient, from the epi, from the social history. But we get to cure lives too, cure disease and save lives too, which is special. But there's obviously a lot of options in ID. We have global health, we do travel medicine, there's transplant medicine, bench science, public health. It is never boring. And I think for sure the coolest cases in the hospital all go to ID. So I'm definitely biased, but I do think that if it's a priority for you to especially take care of marginalized or vulnerable patient populations, if you feel like you went into medicine for service and to give back and to do your part to make the world a better place, then ID is like the natural draw. So yeah, my recommendation would be definitely to talk to your program director and to really do some soul searching as to why you got into this business in the first place.
That was great, Sarah. So one of the things I always recommend, even residents with this dilemma, this predicament, is to go through what I call open endless questions. Ask your why you're doing something, and go through at least 5 cycles of why. You want to do ID, why you want to do ID, to take care of patient, why you want to take care of patient, and so on and so forth. If you get at least to 5 circles of why answers, if you stop at 3, probably you might need to decide on for something else. But if you go at least through 5 cycles, you might be of why, you might be getting closer to the answer. And the second thing, or the second tip I have, is due diligence. The more you do research on what you want to do next, and she was doing an amazing example about either hospitalists or not, and I know hospitalists became quite popular. Interesting, I'm a hospitalist that I've been doing it for 12 years, I still enjoy it. And I remember back on the days, back in 2012, after residency, a lot of my attendings were like, what is hospital medicine? You know, they didn't even know as much of it, you know, don't do that and stuff like that. So things has changed. Now it seems to be more appealing than it was back on the day, I can tell you that for sure. But do the due diligence about what you're getting into. The more research you do, you're going to do a more educated decision about what to do next. So rather than question, we're having some comments, and I appreciate Joanne is mentioning to the panel, great content. Thank you for all you presenting your perspectives. So appreciate that comment. So we're going to go to ask you what tips or recommendations you might have either for residents preparing to go into a job applications because they're going to go into clinical practice, or as they prepare for the fellowship application. Do you have any recommendations or tips for them?
So it comes back to the why, because when you're looking at job application, say you want to, decide where to work, finances are a big part of it. And I know there'll be times when you'll be offered a job which pays a lot, but maybe doesn't meet your personal career goals. So one of the things, it boils down to what you said, you have to do your research about the job that you're looking at. And I'm not talking about just, this is the location, is it hospital-based, make sure you understand what's, number one, the culture of the job, because that will tie strongly into the financials. Here's an example, I'll give you my personal situation. I worked for a small community hospital. I moved here because of that. The endocrinologist who had been there for probably 20 years was ready to retire. And so she had built up the practice, and it was really a community hospital. So what I liked about it is that, number one, she was going to be my mentor right off the bat. 2, we were going to develop programs, improve our outpatient diabetes care. We're not doing a lot of inpatient care. And then she told me that you're not going to be paid much money. And at the same time, she said, you're new, you're younger, maybe you can ask for more or ask for something different. And at the time I had to decide, even if they don't agree to give me the extra money, am I willing to stay here? And I kind of had to make that decision first. You make the decision of, is it the place that you're going to stay? So obviously, number one, your family has to factor in. I'll give you an example. Same example. I live in Georgia. The place where I work is semi-rural, but the place I live is more suburban. And my kids at the time were about to go into middle school, and were like, okay, you're going to be in clinic all day. We have to go to school and then have a life outside of school. We don't want to be in rural Georgia. And so they voted and they won. So I had to do the commute. And that was part of their decision making. But because the family had already decided we want to be in Georgia as opposed to Minnesota, which is where we were before for the weather, that's another thing that goes into it, is what does the family want? As far as the type of work you want to do, I love doing, I know Sara said you'll have to love diabetes. I do love diabetes, but I love thyroid more. And so I was able to have access. I had access to do my own thyroid procedures in office, my own machine, and collaborate with the surgeons in the area. And so for me, I wanted to make sure that I'll have the freedom to do that. So because also I had kind of been building my skill, and I just got my ECNU certification. So I was like, I can't go to a job where I'm not going to use that, because as you know, in medicine, you don't use it, you lose your skill. So I had to make sure I got that part into the contract. And they actually bought the machine when I was coming in. So there's some things you can ask for. You won't get everything you want. So, and I always say, try to think of the things that are most important to you after you and your family, then for your career, and then you can put the finances at the bottom, because there'll be times when they change their financial, the way they pay you. Like, for example, we moved from a system where we're being paid with collections. So that meant you get more money for procedures. Then they moved to a program where you're paid in RVUs. And with RVUs, you don't get paid much for procedures. And so I was like, I still love thyroid. I'm still going to do my ultrasounds. I'm still going to do my FNAs, because that is why I chose. That's why I wanted to do from the beginning. And so there's got to be the why, and then you make sure you prioritize the things that matter the most. And then everything else will fall into place. I can't really, like for fellowship, when you're applying to fellowship, it kind of is the same thing, the culture of the program. Fellowship, they don't pay, so money is not an option. But you do have to factor in the cost of living in the area where you go. I was fortunate, I went to Missouri, which was Columbia, Missouri, which is a college town. College towns tend to be more affordable. So I think with fellowship, the choice is usually who's gonna take you. So it's not always your choice. Sometimes it's who's gonna take you. But of course, you have to make sure your application is as strong as possible. And then when you do meet program directors like Sara, ask those hard questions. One of the questions I asked my mentor, she grew up in Georgia, and I asked her, okay, I'm a Black woman from Africa, how will they accept me? And she said, you know what, Marianne, you're fine. They'll take you. And she said, maybe people will ask you why you're here, there will be that. But, she was very honest. She said, I'm not going to lie, these things will come up. But then I still, it was still okay for me, because then I was mentally prepared. So don't be afraid to ask hard questions when you go for your interview. And the program directors and the team there will be able to give you a clear picture most of the time, and you can make your decision based on that. I hope that helps.
No, that was fantastic. That was great. I actually focus when I'm coaching physicians about they need to, you need at least 4 things to focus on when you make a decision on your career path. One is personal, what is important for you. Second is professional, what your career is going to look like. Third is relationship, and relationship means not only your spouse or your kids, but even family, friends, distant family, and so on, and finances. And one of the things I see the most, as Marianne was saying, sometimes they just focus on one aspect and ignore the remaining. And usually that gets them in trouble when there is a misalignment of some of these 4 things with the career or the job that they decide to go for. And sometimes that led to bad decisions. So as we're getting close to the end, I want Caleb to, I'm going to ask him the question. We were chatting earlier in the QA that nowadays, this is not just about what fellowship or career you're going to decide to go for, but what skills you have. There's a lot of changes with healthcare innovation and things like that is reshaping the way we practice medicine. Therefore, what you will say there are skills or competencies that a resident should acquire early on their career, either if they're going for practice or they're going for fellowship? What type of skills or competencies you think are important to them to develop?
That's an outstanding question, and I think it's difficult to answer broadly, but I'm going to do my best. because I think I do have an answer. But first, I want to say Ryan was talking about mentorship earlier. I just want to add one thing. When an attending or a mentor or somebody says, if you need anything, reach out to me, and then gives you their contact info, actually reach out to them if you need something. And if they don't want you to reach out, that's their fault for giving you their contact info. Because most of us don't give our contact info out to people we don't want to reach out to us. And we really do mean it when we say it. So take advantage of that, because you're missing opportunities to learn, grow, and have a friend, honestly, or someone to support you. So if they say reach out to me if you need anything, actually do it. But to answer the question, the competencies that you should have, like that go broad across all specialties, is I want to mention two things. Don't have a lot of time. Know your limits. Know where you are comfortable. Know your wheelhouse. Know when to ask for help. Know when you're drowning. Don't try to do things that you've seen once or twice or someone kind of pushes you into doing. If you don't know what you're doing, just don't do it. There's somebody out there that does. There's specialists for a reason. There's absolutely nothing wrong with telling a patient, I'm not the person to do this, or this is not something I'm comfortable doing. That's actually safer for the patient, safer for you liability wise. And as a pediatrician, when I tell parents that, they thank me. They don't say, oh man, I wish you could do it for me. Just do it anyway. They say, oh, you know what? We appreciate you being honest with us, because we definitely don't want somebody that doesn't feel comfortable doing something to do it to our child. And people don't want that happening to them either. So know your limits, know when to ask for help. And don't be afraid of that. Don't be ashamed of it either. It doesn't mean you don't know anything different or you're dumber or less than anyone. Like right now, the practice I'm in, two of the general pediatricians have been doing it for 25 plus years. And one of them has been doing it for 10 plus and the other one for 5 plus. And here I am like, ooh, they do a lot of stuff that they've been doing for years that I was never trained to do. It's just training has changed over the last 25 years. And so, and they don't look down on me for being like, oh yeah, I actually don't do that. Either you guys can show me, or I'll just keep telling the patients to come see you. Like you can learn, but don't try and learn on somebody right then and there without supervision. That's what residency and training is for. That also goes for burnout. Know when to ask for help, and do not be afraid to ask for it. And then the other thing that I want to point out is nothing will ever replace the ability to actually listen to a patient and hear what they're saying, no matter what specialty you're in. You could be a surgeon where everyone always says surgeons have terrible bedside manner. I've met some great surgeons that have great bedside manner. I've met some terrible pediatricians that have terrible bedside manner. It trumps everything. Sara was talking about it earlier with infectious disease, listening to someone's story. They are literally the masters of doing that, and they can sit and listen, and then they'll be like, oh, you went over here and you ate this, and then you touched that and you got that. Oh, you have this. The patients will tell you what is wrong with them if you listen. And it's really hard in the way medicine is practiced now, in 10, 15, 20-minute appointments to get that, but just try honing in your listening skills. Don't be worried about what you're going to say. Worry about what they are saying to you.
Perfect. So there, I have a question, and we're running out of time, but maybe we can just answer that before we wrap things up. This is for Sara. Did you know early on that you wanted to stay at your fellowship institution, or were there other practices setting that you consider? And if so, what other settings did you consider and prompt you to stay at Temple?
That's a really good question that has a very dramatic answer that I can say that I would have loved to stay at Temple when I left my fellowship because I was so happy there. I sobbed on my last day of fellowship. But I took a job at Drexel College of Medicine, which is also in Philadelphia. And I was excited because it was an academic job, and it was at a really great teaching hospital called Hahnemann University Hospital. So I don't know if that name strikes fear in your heart, but it should, because it was great and we were having a great time, and I was running the fellowship program there, and I had grants and students and all kinds of wonderful things. I was planning my future at Hannam University Hospital and making connections and building a patient panel. And then the hospital closed. So if you want to talk about goal setting, it was not in my goals for my entire workplace to disappear. And when your hospital closes, the FYI, you lose your job. You get a certified letter in the mail that fires you, and all of your trainees get orphaned, which is the actual name of the process. And you have to find them other places to go, and their visas are in jeopardy. And it is one of the most traumatic and exploitative things that can happen to trainees, to physicians, but most of all to patients. So we had to empty our hospital. And I was one of the last people working there. Like on the last day, there were 7 people left in the hospital. You can imagine ID would be like the last people, right? But it was absolutely horrible and traumatic. And I didn't know what I was going to do after that. I had a whole life plan there. I was 6 years there. So then COVID hit. So it was kind of a good time to reevaluate my own priorities. I actually did HIV community telehealth for 2 years in the community, which was great over COVID. And I got a lot of practice with HIV and gender affirming care and LGBT care. And then Temple called and said, do you want to come be the program director? And I was so excited. I accepted on the spot. So I couldn't have anticipated that would have happened. I didn't know my hospital would close. I didn't know my dream job would open up in the middle of what I was a very kind of embarrassing career lull for me. So the bottom line is you never know what's going to happen. Keep your options open. I would have never thought my hospital would close. I hope none of your hospitals ever close because it's horrible. But yeah, you never know what life's going to bring.
Yeah, I totally agree. Always have a backup plan, an exit on whatever you are. So I want to thanks everyone for being here with us and all the panelists. From the dearly of my heart, I appreciate all this pearl of wisdom that has been so useful for everyone. So we're going to wrap things up. This is going to be recorded and shared at a later time for those that were not able to see us live. And I wish you guys the best day. And thank you so much for being here with us. Appreciate it.